Saylor with Every Family Chiropractic Center, and today I'm talking about costochondritis, big word for rib pain. We had someone actually email us about if chiropractic can help, and I wanted to do this quick video to kind of talk you through what it is and how chiropractic can help. So, a couple things. A lot of times what people think about, they don't think about that the ribs move. So every time you breathe, your ribs are flexing in the front and they're flexing in the back. And so that's how your rib cage moves. So I have my handy dandy skeleton here. So you have 12 ribs. They connect in the front at your sternum, and then they're going to connect in the back at the vertebrae in 3 different little ways. Okay, so you have different connection points. So with rib pain, or if you think about it, you can have it in the front. So people tend to have kind of the symptoms are really tenderness in the chest. It hurts when I breathe. Sharp shooting pain in the back. Number one thing we hear is it feels like someone has got an ice pick and they're just stabbing me in the back right below the scapula. It's usually it can be on the left or the right side. It is also the number one thing that sends most men to the hospital thinking they're having heart attacks. So obviously you want to rule out the fact that you're not having a heart attack. That's the biggest thing. Rule that out first. But we hear it all the time. I have this sharp pain in my left chest, sharp pain behind my left scapula. I think I'm having a heart attack. They go to the hospital and everything's rolled out. EKGs are good, no heart issues, but they still have this pain. And that's when they get diagnosed with the costochondritis. It's hard to say. And so we see it a lot in our practice. We see it, some weird thing, damp, windy weather tends to throw more ribs out than anything. Some kind of weird Chinese meridian, I have no idea, but we see it more often when it's damp and windy. And I've been doing this for 21 years, and so we see a lot of it. And we live in Michigan, so we see a lot of damp, windy weather. So if you think about this, the pain is what brings most people in, and they wonder if you can help and how can chiropractic help. So we do see it in adolescents. We do see it in kids. It's not the really stabbing pain in kids, but that's that deep ache, shortness of breath. I can't breathe really well. It's affected more like when I'm running, because if you think about the movements of running, so things like exercising due to asthma tends to be ribs. So if they're moving and they're running, that's going to affect, this guy's just going to dance today. It's going to affect as you move, it's going to flex the ribs. Okay. So then we want to talk about how chiropractic can help. So a couple key things. The ribs are all movable, which means that they can be out of position or in the correct position or out of position. And if they're out of position, we have to look at it chiropractically, like how can we help? A couple key things, and like people say, you know, how does it happen? We see a lot with coughing. So if you think about anything that increases the pressure in your lungs, it can actually expand your rib cage. So coughing, sneezing, really strenuous exercise, a lung infection. We see it in our smokers. So if you think about if you're coughing a lot because you're a smoker, it's going to affect your ribs a little bit more. Adolescents, we see it more because of sports. It also can be like if you're sick. And right now, Michigan, it's, you know, we're seeing lots of coughing right now, lots of sneezing. So we're seeing a lot of rib stuff. Okay, talking about backing up to how chiropractic can help. A couple key things. The way we adjust is we use this tool, and it looks scary, but it's not. It's super gentle. Basically what it does is it taps under the pain threshold and at a healing rate. So gently tapping the ribs into the right position. We also have a couple attachments. We have this attachment that glides over the rib cage. So depending on what we find in the exam, we would address it from the front and we're going to address it from the back. So you have to be adjusted in both areas. And we actually will adjust it along the rib. Because if you think about a rib, you know, if I do this and it's connected, all your ribs are connected. But if you put pressure on one of the ribs, what's that going to do to above and below it? It's going to affect those two. So a lot of times it's not just one rib, it's usually a combination of a couple ribs. So we want to address the one that's really out, but we also want to adjust the membranes between them and affect the one above it and below it too. So a couple key things, how would we address this? We're going to actually adjust the sternum if it's out. We're going to address the ribs in the front, and then the connection points in the back. So if your vertebrae, think about this, if your vertebrae is rotating, that rib on this side could be rotated out and this rib could be rotated in. So we want to make sure that this is in a really good motion. We want to make sure that you're actually moving. So we don't want it to be stuck. So like easy analogy is like a rusty hinge. So if you think about a rusty hinge and it creaks and it sticks, you want it to be a nice smooth hinge. You want it to move and glide easily, especially when you're breathing. You want rib cage open, rib cage close, rib cage open, close. And you want it to do it in a really nice, easy manner. Okay, so from the back, we would find the rib that's out, especially it's going to be usually here because like the way the scapula rolls on the ribs, it can pop the ribs out here. And we're going to address the vertebrae and the rib heads. Super gentle, super easy, especially when they're so painful. Believe me, I've popped a rib out in the front and it was the most painful thing I've ever had, other than childbirth. So we want to gently adjust them to the right position. We're going to make sure that you use lots of heat or ice, depends on what's going on with you. We want to make sure that the swelling goes away. We're going to work on the interosseous membrane between the two or the three ribs. So we want to make sure that that's aligned. We want to work on the muscles so the muscles are not swelling, because your body, naturally, the first thing your body wants to do is swell around that area so you don't move. And then now you have this complex of the ribs out, muscles are super tight, you can't breathe, everything hurts, and you're like, oh my gosh, what do I need to do? And that's where chiropractic can come in. So hopefully this helps. Hopefully this helps answer your questions about if you have any kind of rib issues. If not, give me a call. We are here for you. So Van Every Family Chiropractic Center, located in Royal Oak, Michigan, and we are happy to help. So have a wonderful day, everybody.